All right, call your next witness, please.
It's Dr. Munn.
I can get you stand right here, face the clerk, raise your right hand.
Do you swear that the testimony that you're about to give will be the truth, the whole truth, and nothing but the truth, so help you God?
I do.
Please have a seat.
Watch your step, stepping up.
You may proceed.
Thank you. And can you please state your name for the jury?
Daniel Munn.
And tell the jury, how are you currently employed?
I'm the Chief of Surgery at Riverside Regional Medical Center.
And how long have you been in that position?
About 10 years as the Chief of Surgery.
And were you there in that capacity on January 6, 2023?
I was.
Okay. And before we get to that date, can you briefly tell the jury about your medical background, your educational background, I should say, so the jury can understand a little more about you?
Sure. I'm a general surgeon by training and specialize in trauma surgery and surgical critical care. I'm the Chief of Trauma at Riverside and have been there for 14 years total. I was in the military before that. That's where I trained to be a trauma surgeon in the Navy.
And where did you go to school?
To Wake Forest.
Okay. And after Wake Forest, were you there for all of your education?
Yes, for undergrad, graduate school, and medical school.
And since that date, have you worked in the medical field?
Yes.
And do you have a specialty?
Yes, trauma surgery.
And can you explain to the jury what exactly that means?
So of the general surgery subspecialties, general surgery includes basically abdominal surgery, breast surgery, skin cancer, things like that. And trauma surgery focuses on pretty much the rest of the life-threatening injuries in the body, but we take care of all injured patients. So it might be car accidents, gunshot wounds, stabbings, things like that. Even falls from standing, falls downstairs, things like that.
And, Your Honor, at this time, I would like to tender Dr. Munn as an expert in the field of trauma surgery, general surgery, and surgical critical care.
Any objections?
No objection, Your Honor.
All right, so qualified.
Thank you. Now I would like to turn your attention to January 6, 2023, and the couple days thereafter. Do you work with a team of doctors?
Yes, we have 6 trauma surgeons and 3, nurse practitioners basically that work with our team. And so I think Dr. Chapp has already testified, but he was the primary surgeon on for trauma at that time. And then the rest of our team were taking care of her the rest of the time that she was in the hospital.
And when you're saying taking care, I should make it clear in the record, you're referring to Abigail Zwerner, correct?
Yes, exactly.
Okay. And you see her in the courtroom today?
I do.
And can you tell the jury, when did you care for her that week that she was in the hospital?
I would have to look at the record to see exactly when we crossed paths, but basically we all work as a team and cover all of the patients in our, on our service. So.
And so what was your role that week when you saw her?
Just supportive care, managing all of her medical issues, managing her critical care. She had a chest tube that we had to take care of, and that is a big part of the focus for our team, but all of her injuries are under our, we're the attending surgeons for her and the primary physicians for her, so we took care of all of her medical needs while she was in the hospital.
And just to help you as you're walking the jury through what you did in her injuries, I'd like to share, and if I can publish it with the jury, Your Honor, I have shared it with opposing counsel. I don't believe there's an objection. It's going to be a demonstrative exhibit. We'll be referring to it as MV13.
Any objection as a demonstrative exhibit?
No, Your Honor.
Okay. So just let me explain to you, ladies and gentlemen, demonstrative exhibit is something that you'll be able to see that assists you in understanding the testimony of a witness, but will not be going back with you to the jury room. All right, so if that helps you taking notes or not. Thank you. You may proceed.
Thank you, Your Honor. And with your permission, it can be published?
You may.
Thank you. And Dr. Munn, do you have that on your screen in front of you?
I do, yes.
And can you walk the jury through what this illustration means to you in regards to Ms. Zwerner?
Absolutely. So if you look at the left side of the drawing, it's basically sort of a mock-up of a person standing up, or maybe laying down, but basically the whole torso. And the two cutouts on the right are images that kind of reflect what we would see with a CAT scan. And so the top one is actually her CAT scan, and then the other one on the bottom is sort of a cutout of what it would look like to slice her like a loaf of bread. So in a CAT scan, her head is into the screen above us, and then she's laying on her back, and then her legs would be sticking out of the screen towards you. And so that, as the CT scanner presents images slicing through the body like a loaf of bread all the way from the head down to the feet. And so they're basically referencing back and forth between the left side of the total of her torso and the cutouts on the right are basically showing you where the bullet went in to the left chest. It went through her ribs, which are to the left of that. So if you look at just the upright one on the left, it's probably easier just follow that course of the bullet. Yeah, sorry.
You're welcome to ask him to step down if you'd like.
Yes, that would be fine. Sure.
Having him direct them. Ms. Douglas, any objection to having him come down? All
So
right.
if you would stand
Yeah,
here.
and just make sure you speak up. All right, thanks.
Okay. It might be easier if I just stand at the screen, if that's okay.
Yes. Okay. Thank you, doctor.
So again, this is the trajectory of the bullet going into the chest, going through one of the ribs, and then through the lung tissue, and then ending up behind the heart, just along the course of where the aorta, or the major blood vessel of the whole body is. And so again, when we're looking at this same image with her sliced like a loaf of bread, it kind of goes in through the side of the chest up here, and then ends up behind the heart, which is this area right there. So the big black areas on both sides are the lung tissue, and then all of this is blood that's collected in the chest from where the injury is. Again, the bullet is this super shiny thing with the arrow going into it. It is backed by her spine and very close to the aorta, which is the biggest artery in the body. So if you look at this image, the aorta comes off the top of the heart, it goes down to the lower part of the body, provides all the blood supply to the rest of the body. And so this bullet is positioned, if you look at this flow up here, it's about 2 centimeters from the aorta and about in her vertebrae spine. So, if you want me to show what 2 centimeters is exactly.
Yes, if you want. Now, Dr. Munn, are you done with those? Do you want to, I can.
No, I think that is pretty much it. This image here gives you a better view of what the CAT scan shows because it shows the tissue more realistically. And so this is her lung that has collapsed and shrunken down because it has a hole in it. And that hole has bled into her chest and allowed for air and blood to leak out into the space around the lung.
Thank you. And then if you'll have a seat back, we'll continue questions. So can you tell the jury the significance of the blown up image where it shows the bullet 2 centimeters from the aorta?
So there are several things about the way this bullet went in that are life-threatening. Certainly the injury to the lung, where I described that it has collapsed. Any human being can bleed to death from that level of injury to the lung. But again, where this bullet ended up, it went past the heart and just barely missed it. And then also ended up within 2 centimeters of the biggest artery in the entire body, which patients would bleed to death in seconds from an injury to that vessel.
And Your Honor, if I may, I do have a ruler just to show the jury what 2 centimeters looks like. If I could approach just so they can understand the measurement, Your Honor, I'd ask for leeway.
Any objections?
Object to the relevance if this is cumulative at this point anyway.
All right, I'll overrule it. She can show the jury what 2 centimeters looks like.
Thank you, Your
on a
Honor. I
ruler.
appreciate that. Jurors, you can see on here. That is the number 2 right here.
The ruler's not going back with y'all.
Bring that back to my. And Dr. Munn, you had talked about the lung collapsing. Can you tell the jury a little bit about that injury as well?
So this is something that we commonly treat that is a life-threatening injury, but the treatment doesn't seem that significant because basically the treatment is to put a tube in and re-expand the lung by sucking out the blood and the air that's around the lung. And so we often do not have to do surgery to get into the chest and fix this problem because the body heals very well when we re-expand the lung. But it is still a very significant injury and something that is can oftentimes cause the patient to pass away at the scene where they're injured.
And the lung, when it collapsed, is that actually scarred to her chest? Can you explain that to the jury?
So the way that we get it to heal is by putting that tube in, it creates a scar that causes the lung to re-expand and stay expanded. And so over that healing process, if we took the tube out too early, the lung would collapse again and she would have difficulty breathing and we would have to put another tube in or potentially do surgery.
And so what does that mean for future surgeries?
So now, as a result of the injury and the treatment for that injury, her lung is scarred to the chest wall. And so that means that anytime, if she had any other injury to that side of her chest, or if she needed surgery to that side of her chest for any reason in her lifetime, we would be going through scar tissue to get to whatever that is. So it limits our ability to treat her for other problems that might affect that side of her chest.
And Dr. Munn, where is that bullet that went into her body?
It
Is it
is
still there?
Yes, it's still in her.
And why was the bullet not removed?
So for something like this, it is actually way more dangerous to remove the bullet than it is to leave it in place because all of those structures that I described that it's so close to are very difficult to get to. And so we leave it in place, assuming that it hasn't caused any additional harm at this point, now that she's stabilized from it, and hope that it won't cause any further harm going forward.
And are there a lot of other people in situations like that where you can understand what that looks like for her going forward? Or is this a unique injury that you've seen?
Your Honor, object is beyond the scope of his records. There's nothing in his designation about this type of testimony.
You have a response?
Your Honor, I will certainly keep it focused on her injury, and he is designated to talk about the injury of the chest and the bullet inside the chest and what that means for her. But I can narrow that question a little bit more, Your Honor, if you'd like.
All right, sustained with leave to re-ask.
Thank you. So, Dr. Munn, where the bullet is in Miss Zwerner, what does that look like for future injuries that she could have or future needs for diagnostic exams?
So there's no way to provide evidence of what could happen over a lifetime, really, because we can't study all of the patients who have projectiles in them. But we know that they typically don't cause harm when they're in a location that is not near something that's moving. But there are certainly events that could cause this bullet to move if she was under a significant impact of some sort. And the thing that we worry about the most really is something like needing diagnostics testing for MRI or something like that, where she has metal in her and an MRI requires using a huge magnet that can cause the metal to move or heat up. And so it would basically prevent her from being able to have an MRI for the rest of her life.
So in the future, if there was a need for a diagnostic testing of some sort, if there was a concern of anything involving breast cancer or things of that nature, is she going to be able to have an MRI?
Your Honor, this is getting far afield of his designation. It's also cumulative. He's already testified to that.
I'm going to overrule it just for this question, but this will be the last question.
Yes, Your Honor.
On
Thank
that
you.
line.
Understood.
It does apply to my specialty as a general surgeon as well. And yes, for someone her age, a female patient her age, it would be concerning that she might have to have an MRI at some point. The most common reason would be breast cancer, because it's very common in women, but also anything else that might require additional imaging. And also, just if we were concerned about the fragment moving, one of the studies that would help us with that would be an MRI, which we wouldn't use for her.
Okay, thank you. And you saw her on January, when she was initially in the hospital, and then you've seen her January 30th of 2023, correct?
Yes.
And then you saw her again February 6th of 2023, correct?
Yes.
Okay. Can you tell the jury, is there any future needs for her to see you? What would that look like in the future if she needed to meet with you? For what reason?
Sure. So the initial follow-up was mostly to examine her for her recovery and make sure she wasn't having any ongoing complications, the most common of which would be pain from her rib fracture, which she did have when I saw her in follow-up. And then again, if there's anything that changes over the course of any period of time, really throughout her life, if she has complications or concerns about her breathing, then she would come to see us for that.
And Dr. Munn, were all of your opinions testified today to a reasonable degree of medical probability?
Yes.
Okay, thank you. And do all of the injuries that you discussed today related to the gunshot on January 6, 2023, the wound to Ms. Zwerner?
Yes.
And are the injuries that she has today, sitting in this courtroom, permanent in nature?
Yes.
Okay. Thank you, doctor. You'll answer any opposing counsel's questions.
Cross-examination.
Just a few questions. Dr. Munn, if the records reflect that you have not seen Ms. Zwerner in over a year, is that consistent with your recollection?
Yes, that's correct.
Okay. Thank you.
Other questions?
Okay, no further questions. All right, may he be excused to go take care of the citizens of Newport News?
Yes, you may, Your Honor.
All right, thank you for everything you do. All right.